The determination study was a United States study led by Dana-Farber Cancer Institute, supported and sponsored by the Clinical Trials Network, the so-called BMT-CTN, as well as endorsed by the Alliance. And this was therefore a national trial, 56 centers, in which we evaluated the impact of autologous stem cell transplant when it's integrated into the treatment paradigm of triplet novel agent therapy, and specifically in this case, lenalidomide, bortezomib, and dexametasone, which we also call RVD. Now, the rationale for this was the question of whether, these triplet regimens are highly efficacious with high response rates and high rates of MRD negative responses and prolonged clinical benefit. So, and also, moreover, lenalidomide maintenance until progression prolongs disease control. So the rationale was, how can we integrate or best integrate autologous stem cell transplant in this treatment paradigm for younger transplant eligible patients? And in essence, the key takeaways were as follows: that there was a highly significant increase in progression-free survival that we saw in favor of early transplant, with an improvement over the RVD alone arm of approximately 21 months, which was remarkable. These were the longest values we'd seen to date. Therefore, there are approximately 46 months of progression-free survival for the RVD alone arm, versus approximately 67 months of progression-free survival for the RVD plus early transplant arm. Now, maintenance until progression was a vital component of this, and that clearly also conferred benefit to both arms. And what was fascinating, though, was with a median follow-up of 76 months, the survival was almost identical at 80%. So this suggested that the use of delayed transplant, or keeping it in reserve, didn't have a negative impact on overall survival, recognizing that the follow-up, it's approaching 7 years, so it's mature, but perhaps we'll need longer follow-up of 8 to 10 years to better understand what that looks like. But I have to say, the survival curves are very stable. And so as we think about that, what does this mean? Why is there such a dramatic PFS benefit, and yet the overall survival is essentially the same so far? Well, what we saw was that the higher, the overall response rates between the two arms were remarkably similar. And very interesting, this was adjudicated by a central response review committee. But what we did notice was that there was a higher rate of MRD negative responses in preliminary analysis from the autologous stem cell transplant early plus RVD arm. And that looked a bit like this. It was approximately 40% MRD negative for the RVD alone arm, and approximately 52% MRD negative for the RVD plus early transplant arm. So this was an interesting clue that perhaps this MRD negativity was an important endpoint in terms of response in assessing the efficacy of treatment. Now, the other thing that we found was, not perhaps unexpectedly, there were significantly higher rates of toxicity on the transplant early arm. And this translated into a very meaningful and clinically significant decrease in quality of life across the transplant process. However, the good news and encouraging thing was that quality of life recovered after transplant, and during maintenance returned to baseline or above, in fact, which was an important finding for our patients.